everyone. My name is Jose Leon. I am the Chief Medical Officer at the National Center for Health in Public Housing. And today we are going to have a really extraordinary discussion on oral health disparities and challenges in individuals with special needs. This is a podcast brought by the National Center for Health in Public Housing. And access to quality, appropriate and timely oral health care services is a significant issue faced by people with intellectual and developmental disabilities. Despite efforts by federal, state, and local agencies and key advocates, adults with intellectual or developmental disabilities remain the largest minority population with unmet oral healthcare needs. In fact, individuals in households experiencing disability rate their oral health as fair or poor at higher rates, around 38%, than those not in households experiencing disability. Those are 23%. This is according to a report from CareQuest Institute. This same report analyzes data from the annual State of Oral Health Equity in America survey and confirm the persistent disparities and challenges in accessing oral health for those with intellectual or physical disabilities. Individuals in households experiencing disabilities, there is a 32%, almost 33% of them had not visited a dentist in 2 or more years. They are more frequently denying healthcare of oral healthcare due to discrimination. They are twice as likely to experience high dental anxiety, and they visit the ED for dental care or pain 3 times more often when you compare them to households not experiencing disabilities. In public housing, according to HUD data, we have around 38% of people with disabilities when you take the total population of those living in public housing. And according to a recent report from HRSA, the health picture of HUD-assisted adults, 6 out of 10 did not receive any dental care during the last year. So this is a big issue and a big concern for health centers serving public housing residents and all their populations. And it is very important to pay attention to this special population. So we are going to have a really brief conversation with Dr. Ambrosio from La Maestra Community Health Center, who is going to join us and going to provide information about an innovative service, an innovative promising practice that they have in place. So hello, Dr. Ambrosio.
Good morning, Dr. Leon. Hello.
Thank you so much for joining us. It's such a great pleasure to have you. We work very closely with La Maestra Community Health Center, and we know all the great services that you provide to the community in San Diego. So can you give us some information about La Maestra Community Health Center, the type of patients that you serve, and the location and the number of clinical sites?
Thank you, Doctor. So, La Maestra Community Health Centers is located in San Diego, California. And we first started as an amnesty center under the Immigration and Control Act in 1986. And we were an education center for literacy. The founder of La Maestra was an English teacher. And it was later on, the Student Council identified that there's a big need in healthcare. And that led to our very first La Maestra clinic in 1990. So after opening our first clinic, we have long lived to our name, La Maestra, which is in English, the teacher. And through the years, after getting grants and fundings, we were able to revolutionize our organization. We're able to develop integrated services into our healthcare, also known as our Circle of Care model. So we're able to work together to identify the total needs of our patients, to guide them and their families to self-sufficiency. And so examples of those various services that we have integrated, they're both non-clinical and clinical in nature, such as pediatrics, OBGYN, programs for transitional housing. We also have food pantry, behavioral health, and immigration and legal advocacies, and of course, dental. So we have included dental too. So we also have liaison people who interprets for our patients, because majority of our population are Hispanics. And going back to dental, our first dental site was opened in year 2000, in one of the small houses here in Fairmont Street in San Diego. And so we catered to the children here in this area who are suffering from oral health diseases, who badly need dental services. And so the demand of patients grew more and more through the years, that led to put up more dental offices. And so our sites are spread over Central, South, and East San Diego. We have 4 dental offices that coexist with our medical side. We have 4 standalone clinics. We have 1 school-based office and 1 mobile dental clinic. And I'm proud to say that 7 of those 10 offices that we have are code-approved clinical training sites for our AEGD residents. And so that's for La Maestra, Doctor.
Thank you so much. That's great information, and we are very pleased to hear all the services that are provided by La Maestra Community Health Center and to the population in San Diego, California. Now, there is the need to have a conversation about people with disabilities in general. The percentage of people with disabilities is growing in the United States, and they have not only healthcare needs, but oral care needs. Sometimes we forget the oral piece of our patients, and this is a really good opportunity to have a really brief conversation on what is the special needs dentistry. What services can you provide through special needs dentistry?
Okay, so special needs dentistry is a practice of diagnosing and providing health care to those with intellectual and cognitive inabilities, as well as those with medical, physical, or emotional challenges. So patients with special needs are those who require unique dental care due to their physical, medical, developmental, emotional, or cognitive issues. So this includes patients with autism spectrum disorders, Alzheimer's illnesses, Down syndrome, genetic problems or spinal cord injuries, and other variety of conditions or traumas that make routine dental operations difficult.
That is fantastic, and it is very special to hear that there is a health center innovating and making sure that our special population patients are receiving the oral health care that they deserve. Now, in regards to the services that you provide for these population, what services are you providing?
So, doctor, so we pride ourselves from doing all scope or comprehensive dental services in general for our dental department. And we are very big with preventive services, because they said, the saying says, an ounce of prevention is worth more than a pound of cure. So coming to the dentist every 6 months, whether there's something wrong or everything's okay, is a type of preventive service. So other types of preventive services that we normally perform are fluoride and sealants applications.
Thank you so much. And you and I were talking about this innovative program. And when did you start this program? Where the idea came from, and what needs do you see in the population?
So, doctor, we have identified that our special needs populations have a gap when it comes to getting their treatment done. So the network that were approved to see special needs in San Diego takes months in order to accommodate them. So we responded to that gap by creating this program. So we have formalized our special needs program just August of last year. And from the time we first started, we have established, let's say, about more than 100 unique patients with 250 encounters. And we schedule it once a month. And we conduct this program in our newly operated site in El Cajon, California, that is bigger, or the biggest of all our locations, with more operatories that can accommodate more patients at one time.
Great, thank you so much. And in regards to the oral health problem that you see in this population, what are the most common needs that you see, or health or dental problems?
So most common are tooth decay, doctor, abscesses, and gum issues, doc.
Thank you. And in regards to communicating with these patients, with someone with a disability, a physical disability is different, when you talk to someone with an intellectual disability. So what is the process, are you communicating through a page, through a caregiver, or do you have a staff helping you to do this?
Right, doctor. So we sometimes, some of them, they have tablets and they communicate through tablets. These are very, very unique cases. However, we try to find out their how they talk, or if they cannot talk, their body languages, doctor. They have caregivers, they have family members that come with them, and together we build that relationship with them. It's hard to say because it is a case-to-case basis, doc, but we do whatever we can in order to impart what we need to impart.
Thank you. And the other question that I have received, either from caregivers or even from relatives, is whether or not general anesthesia is needed in some of these patients. Do you have that experience, or is just do you refer these patients when you have more complex cases?
Yes, doctor. So I believe that we base our scope of practice depending on the level of needs of the patients. We normally try to put them in the tier, so we put them under level 1 as very minimal accommodations. Level 2 is when they have minimal to moderate accommodations, but they respond to directions, but just needs time to adjust. And level 3 are those with needing moderate accommodations that require stabilizers or oral anxiolytics, medications. Now, we only cater to levels 1 to 3 because level 4 are needing severe accommodations that would require the general anesthesia that you were mentioning, doctor. And so we pretty much provide any dental services to level 1 and 2, like fillings, cleanings, extractions, or root canals. However, for level 3, it maybe really depend on how they respond to medications. Now, if they get to the level 4 needing general anesthesia, then we have to refer them out as this becomes out of our scope.
That's great. Thank you so much for that. And in regards to accommodations, do you have a special accommodations for these patients, either infrastructure that you have to update or replace, or do you have equipment, dental equipment that is needed to provide these services?
So yes, thank you for that question, doctor. So I guess this is related to the level of accommodations that I was talking about earlier. I can probably describe this better by how we normally do our methods of treatment on a day-to-day basis. So we use the initial appointment to get to know the patient and the patient to get to know us. So just like everybody else, we are handicap accessible. We have quiet rooms that for those patients who get easily troubled by other people, outside noises, movements, and foot traffic. Sometimes it triggers their behavior. So we put them on a quiet room that we close the door. We analyze their unique needs on their initial appointment. We speak to the parents and the caregivers and identify their level of accommodations on that initial appointment. And we don't do necessarily the cleaning on the initial appointment because the goal is to establish a relationship with the patient. So if we can do the cleaning, but if they're not receptive, we don't force that, and we put that as the second appointment as a minor procedure. They get desensitized in their new environment and new people getting their attention. So we give out some toys for distraction. We give out unique sensory toothbrushes that have multi-surface brush heads, and the one that I also mentioned about the quiet room. And for their next appointments, usually minor procedures, if not done during the initial appointment, then we do the prophylaxis or the cleaning. And this appointment enables us to better gauge what tactic to execute for more challenging procedures should patients need them. So whether we do the distraction approach or the use of stabilizers or nitrous, that's part of the equipment that we have, or if we need to prescribe some oral prescriptions for anxiolytics or a combination of all that.
Thank you. That's excellent. So this is a process, right? I mean, you have to have this initial consultation, making sure that you understand the oral needs of the patients, and based on that, you provide the services that these patients are or these patients need. Now, in regards to the services, and specifically who provides the services, do you need some type of specialization or some type of training to provide these services?
Right, doctor. So initially, before we took on the program, all of us, whoever we have identified, providers, staff who have the passion to help our special unique friends, have undergone training. The use of stabilizers, how do we talk to our special needs patients? However, also our AEGD residents, which stands for Advanced Education in General Dentistry, have been immersed in treating these unique patients as part of their residency rotations. So we are able to give them the residents experience with the special needs, which some of them may not have experience in school or any other health centers.
Thank you. That's very useful. This is information that can be used by other health centers trying to start a program like this one. Now, in regards to challenges, what are the challenges when you have a special dentistry? Either challenges with patients or challenges with infrastructure or collaborations or partnerships? Any challenges in general?
Yes, Doc. So I see this program as a work in progress. So there are a lot of moving parts, which include constant training for our residents, both the present and incoming residents, because the turnover is once a year. So they start their residency in July and they graduate in the end of June. So as we have a turnover of batches, then we have to ensure that we keep the training going. And also changes in workflows, whatever works, then we keep changing the workflows, dealing with referrals for patients that we cannot handle. And these are just to name a few of those challenges. However, I see that the major hurdle that we see in helping our unique patients is that their behavioral management, that only sedation dentistry is the answer. We are working through this. We are working with the San Diego, through the San Diego County Oral Health Coalition in order to combat these barriers. And the next step for us is to find an anesthesiologist who share the same goal as us in order to sustain and expand this program. So to give an idea, we have probably 20 to 30% of our patients being referred out because they happen to fall on a level 4 accommodations needing general anesthesia.
That is fantastic because you are serving a very special population, but at the same time with other they are affected by other social determinants of health. So we have people who are low income, who probably have some housing issues. But as many of them may not be Spanish, if not their native language. I'm sorry, English is not their native language, but Spanish. And it's not only the services, the dental services, but what is everything that is behind the social services that you provide. You already discussed, have a brief conversations about your liaisons and the services that they provide in the community. So it's behind the dental services. There is a large, long mechanism providing previous services to the community. So that's fantastic. Now, in regards to tips, do you have any tips? If I am a health center located anywhere else, and I say, oh, this is fantastic. And I know that based on a survey or recent research that I've done, we have people with disabilities that we would like to start a program like this. What tips would you provide to these health centers?
Yes, so caring for patients with special needs, doc, require compassion, knowledge, and understanding of their behavior. And I would say, let's start with identifying the staff that share the same sentiments and the same passion. I think that's very important because we need support from our staff. And I guess do not be afraid to examine or establish our special needs patients in our respective offices and identify what we can and we cannot do. And once we figure out what we need, find out what resources we have in the county and reach out and collaborate, share ideas with the peers and other organizations. And it may be surprising to know how many people and agencies are, ready to help and support your program.
Thank you so much, Dr. Ambrosio. And this has been a really nice conversation, a brief but very productive conversation about this innovative program at La Maestra Community Health Center. The National Center for Health and Public Housing wants to thank Dr. Ambrosio for her time and her knowledge and everything that she does for the population, the special populations in San Diego, California. If you have additional questions, if you would like to know more about this program, make sure that you contact us, the National Center for Health and Public Housing, and we are going to make sure that any question or any concern or any additional comments are directed to Dr. Ambrosio. So thank you so much for your time. Thank you so much for the services that you provide to the community. And thank you to La Maestra for always being a pioneer in the services that they provide to the community. Thank you so much.
Thank you, Doctor.
As a disclaimer, the contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government.